HIV and AIDS. The human body is able to fight germs that cause diseases. The ability of the body to defend itself against disease is called immunity. When disease-causing germs are strong, they weaken the body's immunity. A strong body can fight disease-causing germs such as viruses, bacteria, and fungi. In this way, the body protects itself against diseases. We then seek medical help, and on taking medicines, our bodies regain their strength. Some germs may be too strong and may destroy the body's immunity such that it cannot fight against diseases. One of them is HIV. HIV means human immunodeficiency virus. HIV is a virus that attacks and destroys the immune system of the body. This makes the body very weak. The HIV causes AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS means that the body lacks the ability to protect itself from diseases. AIDS weakens the body's immunity. When one has AIDS, he or she can suffer from a combination of many diseases. AIDS has no cure. Ways through which HIV is spread. A person infected with the HIV can transmit it to another person. The HIV is transmitted from an infected person to a healthy person mainly through body fluids. Body fluids are liquids or watery substances found in our bodies. These body fluids include blood, saliva, breast milk, reproductive fluids. Reproductive fluids are produced by the male and female reproductive organs. There are several ways in which HIV is spread. These include sexual intercourse, blood transfusion, sharing skin piercing and cutting tools, open wounds, exchange of saliva, infected mother to child. How HIV can be transmitted through sexual intercourse. During sexual intercourse, reproductive fluids are exchanged. The reproductive fluids are produced by the male and the female organs. If you are a healthy girl and have sexual intercourse with an HIV-infected boy or man, you also get infected. If you are a healthy boy and have sexual intercourse with an infected girl or woman, you also get infected. You can get the HIV from someone who looks very healthy. Sometimes it takes many months or even years after the HIV enters the body for the infected person to appear sick and weak. Sex before marriage may lead to AIDS, unwanted pregnancy, and sexually transmitted infections. How HIV can be transmitted through blood transfusion. If HIV-infected blood gets into the body of a healthy person, he or she also gets infected. Blood can be exchanged between an HIV-positive person and a healthy person through transfusion. The process through which blood is transferred from one person to another in a hospital is called blood transfusion. The person who gives out blood is called a blood donor. It may be a friend, a relative, a parent, a stranger, or a neighbor. Blood transfusion is important. After a serious accident or an illness, you may lose a lot of blood. The doctor can advise that you be given blood in order to save your life. If you receive blood from an HIV-positive person, you also get infected. Transmission of HIV through sharing skin piercing and cutting tools. There are many tools we use for cutting and piercing. Some of these include razor blades, nail cutters, needles, tattooing tools, knives, shaving machines, circumcising tools, tooth extracting tools, injecting needles and syringes, scissors, ear piercing tools, surgical tools. If the above tools are used by an HIV-infected person and then used by a healthy person, the healthy individual can also get infected. If the tools are used on an HIV-infected person and then used on a healthy person, the healthy person can get infected. If these tools have to be shared, they must be sterilized every time they are used. To sterilize means to make the tool completely clean by killing any disease-causing germs that may be on it. These days, hospitals use disposable needles to give injections. These are used on one patient only, after which they are destroyed. How HIV can be transmitted through open wounds. In an accident, you may be helping a victim in the accident who is bleeding and who is infected with the HIV. If you have an open wound, cut or break in your skin, and the blood of the infected victim gets into your wound, you will also be infected with the HIV. How HIV can be transmitted through exchange of saliva. Saliva is produced by the salivary glands. Saliva is also a body fluid. The saliva of an HIV-infected person may contain the HIV. If you kiss an infected person in the mouth, and you have sores in the mouth or tongue, or infected gums, you can also get infected with the HIV. If you must give mouth-to-mouth resuscitation to a patient, use the appropriate funnel or tube to protect yourself. How HIV can be transmitted from infected mother to child. An HIV-infected mother can pass the virus to her child before or during birth. The mother can also pass the HIV to her child through the breast milk. Ways through which HIV is not spread. Mosquito bites. Studies have been done to prove that the HIV is not spread through mosquito or other insect bites. Playing with infected children. Children who are infected with the HIV cannot pass it on to healthy children when they are playing. Toilet seats and bathrooms. One cannot get infected with the HIV through using a toilet seat or bathroom that has been used by an HIV-infected person. It is, however, important to keep toilets and bathrooms clean all the time. Shaking hands. You cannot get the HIV through shaking hands with an infected person. Hugging. You cannot get the HIV through hugging an infected person. Sharing food. Children sometimes share food from the same plate. The HIV cannot be spread through sharing utensils. Other infectious diseases can, however, be spread through sharing these things. Living with HIV-positive people. You cannot get infected with the HIV through living with infected people, parents or relatives. You cannot get infected with the HIV through sitting next to an infected person in a classroom, in a vehicle or in church. Hairdresser. You cannot get infected with the HIV if an infected hairdresser plats you. You cannot get infected with the HIV if an infected barber shaves you. Stages of HIV infection. Once a person gets infected with the HIV, he or she does not develop AIDS at once. From the time one gets infected to the time one develops full-blown AIDS, the patient passes through the following 4 stages. The 4 stages are: window stage, incubation stage, symptoms showing stage, full-blown AIDS. Stage 1. Window stage. The first stage of HIV infection is also known as window stage. This stage lasts between 4 and 6 weeks after the person is infected. During this time, the body is trying to fight the HIV. If a medical test is done on the infected person, it may not discover the presence of the HIV in the blood. At this stage, the infected person looks normal and healthy. He or she can still infect other people with the virus. Stage 2. Incubation stage. The incubation stage is also known as the asymptomatic stage. It is the second stage of HIV infection. This stage lasts between 6 weeks and 12 years after the person has been infected. It lasts a shorter time in children because the ability of their bodies to fight diseases has not fully developed. Most HIV-infected children die within 2 years. During this stage, the HIV is inside the body of the patient, but no signs of the disease are visible to other people. At the incubation stage, an infected person still looks healthy. A medical test on the infected person will now discover the presence of the HIV in the blood. Stage 3. Symptomatic stage. This stage is also known as the symptomatic stage. It is the third stage of HIV infection. During this stage, the signs and symptoms of AIDS start showing. Loss of much body weight within a short period. Diarrhea. A fever that lasts a long time. A persistent cough. Skin diseases such as rashes or sores. Sores in the mouth. Other diseases such as tuberculosis or pneumonia. A person who has these signs and symptoms is said to have developed AIDS. However, a person with these symptoms may not necessarily be infected with the HIV. Only a medical test can confirm that a person is infected with the HIV. Stage 4. Full-blown AIDS. This is the fourth and last stage. The patient's body is very weak and cannot fight other diseases invading the body. Most patients die after a short time. HIV test. ELISA test is commonly used during HIV testing. ELISA test shows whether the body is producing antibodies against HIV infection. Antibodies are substances which the body uses to fight disease-causing germs. The body may take a period of between 3 to 6 months to start producing antibodies. This is known as window period. ELISA test will not be able to discover the presence of HIV in the blood of the infected person in the window period. During ELISA test, if antibodies that fight against HIV are found, then the person is said to be HIV positive. If no antibodies found, then the person is said to be HIV negative. ELISA test may show that a person is HIV negative yet the person is infected with HIV. After window period, ELISA test shows that the person is HIV positive. It is, therefore, advisable to go for another ELISA test after 6 months if the results of ELISA test do not discover presence of the HIV in the one's blood. Importance of HIV testing. To decide on marriage. By knowing our status, we are able to make decisions regarding marriage. To overcome fear. When we know our status, we no longer live in fear. If we are HIV positive, we learn to live positively. If we are negative, we learn to protect ourselves. To change the behavior. When we know our status, we are able to change our behavior. If we are HIV positive, we learn to live positively. If we are negative, we learn to protect ourselves and others. To plan the future of one's dependent. By knowing our status, we are able to plan for our dependents and prepare them for any eventuality. To campaign against the spread of HIV. If we know our status, we will campaign and sensitize people on the dangers of HIV. Pre-test and post-test counseling. Counseling is helping a person to understand his or her problem and also find a solution to the problem. Pre-test counseling is given just before one takes an HIV test. It enables one to be ready to take the test without too many fears because of the advice given. Post-test counseling is given after the test is done but before results are released to the person who was tested. It enables one to accept the HIV status and be able to live with the HIV successfully. Post-test and pre-test counseling are done mainly at places called voluntary counseling and testing (VCT) centers, mainly located in hospitals, also in public places. Prevention of HIV. Abstain from sex. The HIV is mainly spread through sex. Sex before marriage is wrong. Girls and boys in school should not have sex at all. They should wait until they get married. To avoid situations that may lead to engaging in sex. Spend leisure time well. Join clubs in your school. Help your parents with housework. Join a religious group. Engage in sports. Choose good friends. Avoid bad company. Avoid the company of men and women who may have bad intentions. Men or women who may pretend to like you, give you sweets, money and other gifts can make you have sex with them and infect you with the HIV. Report to your parents or guardian any relatives, friends, neighbors or any other person who may want to touch your private parts or kiss you. Wear protective clothing. When handling a bleeding patient or an accident victim, always wear protective clothing such as plastic or rubber gloves. Don't share cutting and piercing tools. You should never share razor blades, nail clippers, scissors, circumcision tools, ear piercing tools, tattooing tools or any other cutting tool. If you have to share, always sterilize these tools before using them. You can boil them in water or use methylated spirits to clean them. Toothbrushes should also not be shared. It is unhygienic. Cover open wounds. All open wounds, cuts and breaks in the skin should be covered. Seek medical help. Trained doctors, nurses and health officers sterilize needles, syringes and surgical tools after every use. They also use disposable needles that they destroy after every use. They also check all donated blood for the presence of the HIV before they give it to a patient. If you happen to fall sick, you should not go to unqualified people such as quack doctors who claim to have medical knowledge. You can get the HIV from the instruments which these people use. Myths and misconceptions about HIV/AIDS. A myth is a false idea or false story that many people believe is true. A misconception is a wrong or untrue idea which people believe because they do not have the facts or do not understand it at all. Myth. AIDS does not exist. Fact. AIDS exists. Many people are infected with HIV and others have died of full-blown AIDS. Myth. AIDS is a result of witchcraft or some curse that makes a person get thin. Fact. AIDS is caused by human immunodeficiency virus. It is acquired through body fluids such as blood and reproductive fluids such as semen and vaginal secretions. Myth. AIDS can be cured through witchcraft or having sexual intercourse with a girl. Fact. AIDS has no cure. Myth. AIDS can only affect immoral people. Fact. Anyone can contract AIDS. Myth. AIDS patients and HIV carriers are always thin. Fact. Becoming thin does not necessarily mean that someone has AIDS. Myths. AIDS can be spread through swimming together, eating together from a common plate, sharing utensils with an infected person, mosquito and other insect bites, sharing toilet seats and bathrooms, shaking hands or hugging, living with infected person under the same roof, being plaited or shaved by an infected hairdresser or barber. Facts. HIV/AIDS is spread through sexual intercourse, a blood transfusion, exchange of saliva, breast feeding, open wounds, sharing piercing and cutting tools. Care and support for HIV-infected people. People suffering with HIV/AIDS need adequate support. They need medical care. People suffering from AIDS have weak immune system and so they suffer many diseases which require medical attention. Love and care. They need love and care just like everyone else. They need friends to talk to and to play with. Hygiene. HIV/AIDS patients should be helped to maintain high standard of personal hygiene. Adequate diet. The infected should be given a balanced diet for every meal so as to prevent them from many diseases. Financial assistance. Financial assistance to take care of the needs of the sick. We can also help people suffering from HIV by cleaning the compound, caring for the children, collecting water, washing clothes, cooking food. Effects of HIV/AIDS. Effects of HIV infection to a person. Lack of strength to play, work and enjoy oneself. Lowering self-esteem. Poor performance at school or at the place of work. Lower standard of living since more money is spent on drugs and to cater for other expenses. Sicknesses associated with the HIV/AIDS such as fever, TB, diarrhea and skin rashes. Effects of HIV infection to a family. A lot of money is spent on drugs and other medical expenses. Brings sadness in the family. Loss of earnings if a member of the family, who is also a breadwinner, dies. Lack of parental care and love to children when they lose one or both of their parents. Effects of HIV infection to a nation. Increased number of school dropouts due to deaths. Poor agricultural production because of reduced number of young and energetic people. Poor economy. Poor health care and congestion in hospitals. Loss of foreign exchange due to cost of importing medicine. Loss of young people leads to slow economic growth due to reduction of working population. Control measures for HIV and AIDS. There are various measures that can be taken to control the spread of HIV/AIDS. Most of these measures are meant to create public awareness. To create public awareness means to inform people about something. Creating public awareness on HIV/AIDS refers to bringing the attention of the community concerning the existence of HIV/AIDS and the fact that it has no cure. Public awareness may be created through community gatherings which often take place in chiefs' barazas, church services and crusades, marketplaces, weddings, funeral and burial services, security meetings, other formal and informal meetings. Public awareness is also done by conducting campaigns through various media. Media refer to various means of communication that reach all or most people in society. Media include television, radio, newspapers and magazines. Television and radio can air programs educating the public on HIV/AIDS. Newspapers and magazines could also publish educative articles. These days there are other forms of media that include Facebook, Twitter, and Instagram, commonly referred to as social media. Mass education. Mass education is also another way of controlling the spread of HIV. Masses refer to many people. Mass education refer to the education that is given to many people at the same time. Mass education can also be conducted through mass media, social media, public rallies, seminars, workshops, pamphlets, booklets, Newsletters and brochures. The masses are informed on issues like meaning of HIV/AIDS, causes of AIDS, modes of transmission of HIV/AIDS, traditions and cultural customs which can lead to spread of HIV/AIDS, myths and misconceptions on HIV/AIDS, stages and development of HIV/AIDS, importance of HIV/AIDS testing, signs and symptoms of HIV/AIDS, effects of HIV/AIDS on an individual, family and nation, ways of taking care of HIV/AIDS patients, ways in which HIV/AIDS can be prevented, ways of supporting those infected and affected by HIV/AIDS. Thank you for watching this lesson. It is our hope that you now have a good understanding of HIV and AIDS. Don't forget to subscribe to this channel and other Genius channels relevant to your level of study.